Hi, I'm Heath McGowan. I'm one of the anatomy lecturing staff at Bundoora, and I endorse this clipboard product.
This is a short presentation on the lateral compartment of the leg.
A lateral compartment. These run posterior to the lateral malleolus and therefore produce plantar flexion at the ankle joint.
The lateral compartment is the pronating compartment because more distal to the ankle, it causes the pronation. Its boundaries are the lateral surface of the fibula, the anterior intermuscular septa, posterior intermuscular septa, and the deep fascia. So we're looking at the lateral compartment of the leg. There's only two muscles. We have boundaries, the surface of the fibula, we have a posterior as well as an anterior intermuscular septa, and finally deep fascia as a boundary. We see that peroneus brevis or fibularis brevis, those are used interchangeably, is deeper than peroneus longus. We find that shorter muscles tend to be deeper than longer muscles, so that the origin and insertion don't have to poke their way through a muscle or a tendon, because that could weaken the muscle. The lateral compartment, they all have a common action. They assist in pronation, and that occurs at the tarsal joints, so distal to the ankle joint. They all assist, or both assist, in plantar flexion. They both get their blood from the peroneal artery, and they're both innervated by the superficial peroneal nerve. So looking at the lateral compartment, we have deep peroneus brevis or fibularis brevis, if you prefer that terminology. It has its origin on the shaft of the fibula in the distal 2/3. It runs down the posterior of the leg and posterior to that lateral malleolus and attaches to the base of the fifth metatarsal. Fibularis longus is longer and more superficial. It's going to run more superficial to the peroneus brevis, also running posterior to that lateral malleolus. It then goes in the plantar surface of the foot. There is a groove in cuboid, and it passes through the groove in the cuboid bone and attaches to our medial cuneiform as well as our first metatarsal. And we can see that because both muscles are passing posterior to that lateral malleolus, they must be assisting in plantar flexion. Looking at the distribution of the tendons at the ankle, we're only interested in the lateral compartment. We have peroneus brevis, peroneus longus, both passing posterior to that lateral malleolus. Peroneus brevis, of course, attaching to the fifth metatarsal. Peroneus longus going through a groove in cuboid on the plantar surface to insert onto the first metatarsal and the medial cuneiform. Bearing in mind that structures which cross the ankle joint or talocrural joint posteriorly will cause plantar flexion, which is true flexion, while tendons running anterior to the ankle joint will cause dorsiflexion or true extension, as well as structures or tendons which cross the subtalar joint laterally will cause pronation, while structures which cross the subtalar joint medially will result in supination, as well as the fact that tendons which attach to the plantar surface of the digits will cause flexion, while tendons which attach to the dorsum of the digits will cause extension, please fill in the following table on muscles of the lateral compartment of the leg. Remember to put in which joint the tendon crosses and the position relative to the joint, as this will enable us to work out each muscle's action at a specific joint.